Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is avian flu. We will be discussing this topic in order to raise awareness of what avian flu is and how the current outbreak is affecting us. Joining us today is Dr. David Crum, State Public Health Veterinarian for the Maryland Department of Health, and Dr. Michael Odian, Animal Health Program Manager and State Veterinarian for the Maryland Department of Agriculture. Welcome to our show, and thank you so much for being with us today.
Excellent. Thank you for having us.
Thanks. Thanks. So let's take a second to have you guys introduce yourself to the audience. So what is your connection, and please let me know what your connection is to the topic of avian flu.
Oh, again, great question. So as you mentioned, I'm the State Public Health Veterinarian for Maryland, and you might ask, well, what is a veterinarian doing at the health department? And really, as the public health veterinarian, I bridge that gap between human medicine and animal medicine, and really trying to go, again, it's a concept of one health in which animal health, human health, and then the health of the shared environment are really interconnected. So that's really the role that I play in preventing and controlling diseases from animals to people, and really trying to fulfill that one health. So how it applies to avian influenza or avian flu is I would be working with local health departments, working with our other state and federal partners, dealing with the response and making sure that it doesn't go to either the responders or to the general public. Really that animal to human interface is where I would be.
It's interesting. Thank you. Dr. Odian?
I'm the state veterinarian for the Maryland Department of Agriculture. We're charged with regulating the poultry industry, and so to ensure food is safe, there's a lot of testing that goes on, which includes testing for avian influenza. In terms of an outbreak, which we did have in 2022, I am the incident commander in charge of the entire response and coordinating where people go, how resources are managed, and how the response goes, and working with Dr. Crum and the incident command structure, as well as our federal and other state partners. And we do rely a lot on county resources to help us with the response.
That's interesting. Thank you so much, gentlemen. So let's go into the topic today. So what is avian flu? What causes it? And what type of birds can carry avian flu?
Do you want me to start, or can I go? All right, well, what is avian flu? Avian flu is an influenza, not going to get too technical, but basically an influenza virus that affects birds. It affects primarily wild birds is what we see right now. You may have seen in the news, there's a lot of information about up during the flyways. You're going to see these wild birds as they migrate. You're going to see some unfortunate deaths associated with that in the wild bird population, and so forth. And what we really worry about is that transmission from the wild bird population to domestic poultry. You know, that's our food source. We want to make sure that we have food security. So it's that transmission that really is something that we worry about. And that's where our partners here at MDA play an essential role. I don't know if you want to kind of take it from there, Mark.
Pretty much all poultry products, broilers, eggs, the birds are tested for avian influenza before any type of movement to slaughter, and they're tested on a regular basis. There's two types of bird flu. One is low path, which is concerning, but doesn't set off as many alarm bells as the other version, which is high path. High path sets off a lot of alarm bells. It is what we call a foreign animal disease. So it triggers a foreign animal disease investigation and also a federal response. Right now in the country, there are 47 states that are affected.
Wow.
We are seeing it both in commercial birds and also what we call non-commercial, or what a lot of people refer to as backyard flocks. So it's not discriminating. It is in the wild birds for sure. USDA Wildlife Services does a lot of surveillance testing. We do various testing for DNR when they have a wild bird that has neurologic signs or unexplained death. We'll do the testing for them. And so there's a lot of testing that goes on to ensure that the food is safe.
Interesting. Thank you so much, gentlemen.
Oh, sure.
And so what is our current situation with avian flu, and why is it such a big deal? I know that we've been joking a lot, but is it to blame for the high egg prices that everyone keeps complaining about?
I'm sure it plays a role. I mean, there's a lot of different factors, but yeah, it is a concern, and you've seen a lot of things in the news about it. You know, what the current situation is, and as Dr. Odian mentioned, I mean, we have 47 states that are affected. You know, we have almost 60 million birds that have either been infected or culled as a result of that infection. So it does put a significant strain on resources, and that's a food security issue that we want to protect. But what is the big deal? I mean, from the public health side, you know, the risk to the general public is low. You know, this is mainly a risk in which it'll be individuals that have close, prolonged, unprotected contact with, say, sick or infected birds with avian influenza. So that is potential wildlife operators that are working with the wild bird population, poultry responders, or responding to an outbreak at a farm, or you know, the backyard flock if they have issues potentially. That's really where the exposure goes. But the overall risk is still really low, you know, to the human population. This virus has not really adapted for efficient transmission to people, from birds to people, or human to human transition. I know we're going to get into that in a little bit for you, but where we are now, it's mainly a veterinary or an agriculture issue. And again, our partners at MDA really are taking the lead, and we're there to support their efforts.
That's great.
There's a lot of factors that go into the pricing that the consumer sees at the retail end. The supply is a small cog or spoke in that wheel. So when you have a disruption in one part, there is a cascading effect, but I wouldn't blame everything totally on the bird flu because there are a whole bunch of other factors that play into it. Supply chain's one of them, fuel cost, delivery cost, labor cost. I'm sure if you've got an economic person,
we just keep
bore us with all the details.
We could do a whole segment on that.
Yeah.
So according to the CDC, the avian flu virus has been detected in over 58 million commercial poultry birds in the U.S. since January of 2022. What mitigation measures can be taken to stop or slow the spread of this virus in the future?
Sam, do you want to take it?
Yeah. Basically, the HPAI, or avian flu, is a foreign animal disease. And the minute we have a detection, there's a whole cascade of events that occur. The method of control for this particular foreign animal disease is depopulation. So in a case scenario where you have a four barn bird population, say a broiler farm, 4 barns, if one barn is detected, the other 3 are not, all 4 barns are depopulated in a way to stop the spread. There's a whole cascade of events that goes on. Control zones are put in to increase the testing and monitoring of the farms that are close to the index farm. We actually have what's called a 10K control zone, and then we actually go out to what's called a 20K control zone. In the 10K control zone, because that's considered the infected zone, testing is very rigorous. It's done very, very quickly after the detection. 20K is a little further out. There's still testing, but it's not as rigorous a requirement for the amount of testing done. Anything in the 10K zone also has to have permitted movement in or out. So everything is very controlled when you have a detection. So amplify that by 47 states.
Wow.
It's quite an operation.
I can imagine.
And so in order to manage all this, you need your state, federal, county. Everybody has to work together and work well together.
Yeah, that sounds like all hands on deck operation to me.
Pretty much.
So how can we tell if a bird is infected with avian flu? What are the symptoms?
Well, I can kind of start. I mean, it can vary widely. I mean, that's the thing. As Dr. Odian mentioned, we either have low pathogenic avian influenza, which may just cause illness, but not necessarily death, or kind of lower things, or this high pathology, high path AI, in which you have a flock wiped out in 24 to 48 hours. So, with these, again, if any bird is acting abnormal, basically sick, not able to get away, acting weak on the ground, those are things that we worry about. But again, there's other diseases besides avian influenza. We have other things to potentially. But again, it's as we're talking to people about, I'm sure you're educating poultry owners and the occupation of what are the signs to look for. There's a lot of efforts and kind of surveillance and monitoring.
The biggest thing we found with this 2022 outbreak is about 24, 48 hours before we see clinical signs, we see a decrease in either water consumption or drop in egg production.
Oh, okay.
So that was kind of the early warning beacon. And then usually within 24 to 48 hours, we see clinical signs.
Okay.
It can be a variety of neurologic signs, sudden death, blue wattles, combs, feet, number of different things. But once you start seeing the clinical sign, the disease does rapidly progress. Okay. And one of the things that's a bit of a misnomer that we've heard from our partners in Pennsylvania is that people think, well, they'll get over it. No, they won't. It will eventually lead to the death of all the birds in the barn and eventually to all the birds on the farm. And we've seen that in the Midwest states where they had issues getting resources to places to do the depopulation. They had delays and they could see barns just going down the line and birds popping with clinical signs and dying. And so it's not something that the birds are going to get over.
Interesting. So how can avian flu be spread spread to humans? And if so, what is the severity of illness?
Great question, and that's come up a lot. That's always, the general public is, how can I protect myself? What is that risk? Now, as I've stated earlier, the risk to the general public is low from, avian influenza. But again, it's the workers in an occupational setting, response setting. But what are some of the steps you can do? First thing, washing your hands. I know it sounds like a basic tenet, just washing your hands, but you're going to be infected or potentially exposed to the virus either in the fecal material from the birds, saliva, mucus, or the environment that's potentially contaminated. So if you touch that and then touch your eyes, your mouth, or your nose, that's how most people would potentially be infected. So hand washing works against viruses, bacteria, general tenet of public health, wash your hands. The other ways you can do it too, get your seasonal flu vaccine. The real worry that we have is with this virus, are you infected with the seasonal flu and then potentially with this avian influenza? Not so much that you're infected with both viruses, but do they recombine to create a new virus? That's what we worry. So washing your hands, seasonal flu vaccine, and then wearing appropriate protective equipment. If you are going to work with wild birds or are going to work with potentially sick birds, wear gloves. Wear potentially a mask. One thing COVID has taught us is N95s is not a foreign term anymore. Using protective stuff. If you are going to work with birds and have birds at home, wear different clothing. Make sure you're not transmitting that to either your flock or potentially to you. So wash your hands, seasonal flu vaccine, and wear protective clothing are the three main tenets that's going to work. But again, overall risk to the general public, really low.
It's definitely important. And if you're going for a hike and you see a dead bird, don't go near the dead bird.
Exactly. We always say enjoy wildlife from a distance. It's Maryland has tremendous natural resources. Again, not just for avian influenza. I work on rabies, tick-borne disease. There's a lot of different things. So it works for both.
That's awesome. Thank you. And so what are the symptoms that avian flu can present then in humans if they do come in contact?
If they are going to get it, it ranges from no signs at all, mild clinical signs, maybe conjunctivitis, all the way up to severe pneumonia and respiratory issues. Now again, what we've seen so far, either in the United States or globally, again, are these mild. We haven't seen it. It's very hard currently for the virus to go to humans. And again, from that, we're seeing very limited human-to-human spread. So we have not seen that, but that's the reason why we're watching this situation so closely.
Okay, that's really important. How can avian flu spread from birds to human, and can it spread then from human to human?
Yeah, I've kind of briefly touched on it, where again, it's either the sick bird itself or the environment in which the human can get infected. Really, human to human, we haven't really seen it with this virus, or it's very ineffective. So again, it's something that our state, federal, local partners too are really watching for that. You know, we have our seasonal flu surveillance. You know, we watch that. There's a lot of testing involved associated with that, so we can see maybe some of these genetic markers, or if it does pop up, we have that surveillance combined with what Maryland Department of Agriculture is seeing in the birds to give us that One Health, that complete comprehensive picture.
So say if I was going on that hike and I saw a dead wild bird and I was like, oh, let me go see what this is, and I come in contact with it. What should you do if you do come in contact with a wild bird that may or may not be sick?
Again, a great question, and it's something that we're going to come across. Really, if we can't or we have to interact, or say you're a wildlife rehabilitator where that's what you want to do, again, wearing that protective equipment, gloves, potentially a mask, really washing your hands. And again, it's really those basic tenets that really go into it. If you see sick wildlife or are aware of it, there is a number we can call, and we can provide that afterwards, or from Department of Natural Resources that works with our partners at USDA, and really trying to make sure that we can see this. If we see this in the wild bird population, say in vultures, birds of prey, we always worry about our bald eagle population because they do scavenge, and it's mainly where we think the scavengers are picking it up from the dead birds or dead animals. That's where we're seeing it kind of transmitted. There are resources and ways to easily protect yourself.
And so people understand, the poultry are not giving it to the vultures, and then the vultures giving it to the wild bird population. If you look at the migration pattern, they had problems with high-path influenza in Europe, and there's a place where all the birds kind of up by Iceland, all the birds integrate. So it was a matter of time before it came down to the United States and down through North America. So. And we know through genetic sequencing that the domestic poultry HPAI is genetically different from those that are found in the wild birds. And to just not to scare people, but to kind of give you a better picture, when we go into a detected farm to clean it up, depopulate, we're wearing full personal protective equipment, suits, mask, goggles, gloves. So it's treated as a select agent, to say, but it's not a worrisome select agent. So there's clean, dirty lines set up. So before you can come on to the clean side, you have to take off all your personal protective equipment, everything's disinfected, and then you're allowed to come onto the clean side. And as a responder, they're supposed to either take showers. If we provide showers on site, they take showers, or they go back to home, hotel room, wherever they have to go to, and they take showers. So again, we take the virus very seriously because we don't really want it spread anywhere. So when you see that sick bird and you're out on your hike, call the numbers, take a look at it, take a picture from the distance. Don't
go and start playing with it.
Don't play with it, no.
So what is the treatment for avian flu in birds, and then what is it for in humans as well?
There really is no treatment for high-path avian influenza in birds. The control measure is depopulation.
Not an option in the human population. So we're very good. So as soon as it is diagnosed or we identify it, we want to start antivirals. We do have a lot of antivirals for seasonal flu. There are medications that are effective in conjunction with supportive care. At this stage. Again, it's a low chance, but again, if it is identified, it's the antivirals and supportive care.
That's interesting. What preventive actions can be taken against avian flu, especially for those who work around wild or domestic birds every day?
Well, we touched a little bit on it. Again, those 3 tenets I keep coming back to, wash your hands, seasonal flu vaccine, and appropriate, personal protective equipment. Really just being cognizant of that concept of really of biosecurity. Diseases go both ways. It goes from humans to animals, but also animals to people. And it's something that, if you're thinking of it that way or really looking at the situation, that kind of lends itself to taking those steps. You're going to wash your hands. You're going to be watching out. Some of the work that we do with MDA for the responders, we actually follow up with them to make sure they're fine 10 days after last exposure. Watching for clinical signs, and then speaking with either your local health department if you have questions, my office, or your primary care provider, trying to figure out, yes, I'm showing flu-like signs and I've had exposure to birds, should I be tested? And then that starts the chain for going.
On the animal side of it, for poultry owners, the biggest thing, again, is biosecurity, biosecurity. If you having completely separate footwear, clothes for when you go and deal with your poultry is ideal. Then it stays over there when you go into a house or you go to town. You have separate footwear, so there's less likelihood of tracking to your poultry. The commercial poultry farms have very, very strict biosecurity rules and procedures, and then depending on, like, if you're actually up to a level of what's called a primary breeder, which is the producer that produces the eggs for all the birds that go into production, their biosecurity level is extremely high, to the point like you have to shower in and shower out in those facilities. So again, at home, do you have to make a makeshift little shower before you go into your chicken coop? Probably not. But having a separate set of boots that right before you walk into your chicken coop, you put these separate boots on, you put a separate coveralls on, go and do your work with your poultry, step out, have can of Lysol, believe it or not, is pretty good. We keep them in our trucks. So whenever we come off of a poultry farm, we spray everything with Lysol. If you want to get really sophisticated, you can do disinfectant bath where you dip things in the disinfectant bath. But again, it all comes back to biosecurity.
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 I think I got that one.
You got it.
So can avian flu virus spread to other animals such as cats and dogs?
Another great question. You've seen in the news, porpoise, dolphin. We've seen lots of mammals as well. It does have the potential to go from birds to mammals. And what we're thinking of is, again, the scavengers. We're seeing these mammals. They're typically predatory. They're going to be foraging or scavenging on the wild birds. Now, we have not seen that go any further. And it's not really surprising that we see sporadic infection of mammals with this H5N1 because of just how many sick birds are out there. Again, we have not seen that transition from mammal to another mammal. We haven't seen that continue the chain of infection, and that's where it's really relevant for the human population. Again, but it's something that can change. We're seeing right now with the virus, it can't do that. We're monitoring to make sure if it does, that we'll be ready for it. So the risk is there to the general population, domestic pets, dogs and cats. How do we worry there? They can potentially get it, but again, that risk is really low. And even, the general tenets of trying to avoid wildlife. That's why having your animals outside, trying to really monitor them and prevent that potential exposure.
Okay, and then so if my dog comes in contact with a pet while we're hiking, so what should I do with that?
I was saying pretty low. I mean, at this stage, I always say if you have general questions, always consult with your regular veterinarian. But monitoring your health, being that good, responsible dog or cat owner, checking them out. If they start to show signs of not eating, respiratory signs, that's where our colleagues in the clinical profession kind of come in to help us out, and we consult with them. If they see a case where they're not sure of, Dr. Odian and myself talk. We can work with our USDA labs. There is a way that we can start to look into that. It's a case-by-case basis, but we are, again, surveilling and really trying to make sure. Yeah.
Is there anything else that you gentlemen would like to add for today?
No. Do you want to start, boss? Or? Well, I mean, a couple of the take-homes. You know, we always worry, is chicken safe? Yes. If you cook it properly, chicken is safe to eat. You know, that's one of the big things we really want to go with. The general risk of the general population for avian influenza is low. It's mainly an occupational exposure. And then two, knowing that we are here in that One Health Collaborative, partners in agriculture, public health, as well as federal, state, and then local health partners, really here to try to address the issue and make sure if it becomes a problem, we're there and we're ready for it.
Great.
Yeah. And I would say too, you know, go out, see the wild birds, enjoy the wildlife. Maryland has wonderful wildlife, both you know, up to the Conewago Dam all the way down to, you know, Ocean City and the Eastern Shore. If you see thicker or dead wild birds, just use the phone numbers, call. Don't try and deal with it on your own. You know, hate to sound like a commercial, but let the professionals come in and handle it.
We
Thank
got
you.
it. Yeah.
Thanks, gentlemen. Well, that's all the time we have for today. I'd like to thank my guests on today's show, Dr. Crum and Dr. Odian. If you'd like more information on avian flu, please refer to the resources page after the show. And join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you by Harford TV. Watch what matters.